Good afternoon, everyone. Thank you, OAFI, Dr. Regis, and the team for inviting me here to speak with you about artificial intelligence. And thank you all, especially because nothing would be possible without you. So I'm delighted to be able to contribute in my way and to clarify a few things. So let me tell you a little bit. I'm not here to speak about super complicated things or horrible technicalities, which I'm sure you're tired of hearing, about artificial intelligence all over. A giant robot will come, no one understands anything about it, and it will replace us all, and it will do away with humanity. No, I want to be realistic. I don't come from the world of software. I'm not an engineer. I am an intruder, so to speak, in the sector, but I do have to say that the world of patients has accompanied me in my career for several reasons, and the world of technology as well. So, with my presentation, I want to bring us a little closer to artificial intelligence so that every time you hear AI, you will know exactly what it is. So you put a face to that monster that scares us all. My company, Sermes CRO, I don't know if you know what it is, but basically our company carries out clinical trials with sponsors, labs, doctors, hospitals, anyone who wants to launch a clinical trial. They use a CRO to delegate functions. It's a very long and tedious process. So what is a CRO doing in artificial intelligence in healthcare? The million-dollar question. These are our activities. We are somewhat different as a company, and besides being a CRO, we are devoted to the development of some special units because after attending many congresses, expertise of many of our colleagues, we're hearing the patients' feedback. Many times we hear this company is specialized on this one on that, and they don't really combine the expertise of one with another. The one that knows about AI doesn't know about health. So our intention was to do things well, not just to develop without any certainty, and to be able to combine everything. We want to develop the new technologies in a healthy and useful way for everyone, for the benefit of the patients. And myself as well, I'm a patient as well. So, artificial intelligence is a way of mechanizing the human brain. We obtain information from the environment with our five senses. I'm hungry, I go to the fridge, open the fridge, what shall I have? And then we look, we salivate, we smell, everything is interacting. Okay, I have elements that are entering through all my senses in my brain, and there is where I process the information that will help me take a decision. So what do? We create a machine that does that in an automated way. It won't help us solve the problems of mankind. It just automizes processes. We know the original elements. We know how to process that information, and the machine will help me take decisions. When you have many elements, we come to a point in which it's too much and I don't know where to go, which decision to take, because I have too many variables so as to be certain of one choice or another. Machines don't have these feelings, and they facilitate the decision-making process, and they can help us when we have many variables. If it's difficult to take a decision, they can automate that. This is the advantage. So this is a little bit what artificial intelligence does. We have different kinds of artificial intelligence. We have the automated artificial intelligence, which would be a little bit used in logistics warehouse, Amazon, etc. They use these things because in an automated and systematized way, they manage the warehouses. Assisted artificial intelligence, labs and different companies, car washes, where you could visualize it more with machines or robots that know exactly where to put the screw or which will move a test tube one way or another. Then we have augmented artificial intelligence, which is one of the ones that we are most working with, which would be related to imaging systems to diagnose some pathologies through imaging techniques. And then we have autonomous artificial intelligence, like with the autonomous vehicle. It learns with time. Now, where are the boundaries of artificial intelligence? As I said, it will not replace us. It will not. Artificial intelligence will never be able to do some things. I always like to give the example because when I do these presentations, I want to highlight Rafael Nadal, who is unpredictable. This year, he was getting to the final round of many tournaments. He's a certain age with physical problems, and he would win. So this is a rupture of artificial intelligence. What else could be? The lottery. Artificial intelligence, for the time being, will not guess the lottery prize number. Also, time traveling, not something that artificial intelligence can deal with. And then predicting the future. We can predict some things with some certainty with clear variables, processing, and decision-making process. It is always be the person who will define the process. So foreseeing the future, how many children will I have? What company will I end up working in? These are very subjective variables as the rest. They are not measurable, or you cannot quantify them, and they will not help me define something realistic in a software, something with logic reasoning. So, once we've explained this, what can I use artificial intelligence for in healthcare? Well, AI, as you heard, can be used to prevent diseases. It's one of the main goals. This is something that we have in general terms. There are many, many things in which artificial intelligence could help. We are making headway preventing disease and lesion, discovery of new therapies, could help also improve the efficacy of healthcare providers. Also in the surgery, you may have seen there are many ads that have to do with the surgeons that will be able to operate from anywhere in the world. It does open the door for many possibilities that would benefit us in this sense. We're also speaking of intelligent prosthesis, genetic analysis, analyzing clinical images, and improving the quality of life of patients. This is something that artificial intelligence can also help us with. I want to introduce a little bit about wearables in healthcare, which is something that we have more or less seen already. Artificial intelligence is here. It's not something that will come. It's already here with us. So I do like to speak of these wearables that we all have with us and we don't realize. So we are also participating in artificial intelligence. I already have some devices that are taking measurements of my health. So, what do these wearables help us with? With the monitoring of our pathologies to help patients be more experts. No doubt wearables make people be more interested in their health, heart rate, how many hours we slept. We like to see that, right? How many hours of deep sleep or light sleep that we measure with our watches. This makes us be more aware of our disease and know more about our health. This is part of the role of the expert patient that we hear about when we hear about patient advocacy. Next, we have healthy lifestyles. It will help me improve my quality of life, my health, adhere to therapy. Many of these wearables integrate alarms to combine with treatment to remind you you have to take your medicine, besides combine it with physical exercise. The relationship between doctors and patients. There are many patients nowadays that share information of wearables with their doctors so that the doctor can be aware of the real monitoring of the patient. So they already know you more in depth. It's not just, these are the results of my test, and that's it. You won't know anything else until I bring you my next test. But rather, the doctor can have information of the patient during that time. So these variables help us. They also help us in the early diagnosis, because with a daily monitoring, it can help us anticipate to when someone will suffer a certain pathology. And then accessibility. These wearables help us be concerned about our health and our pathology, and the fact that we have a wearable makes us have more access to all this. It used to be very difficult for us to measure this and keep up to it. Types of wearables, I've mentioned some. We have bracelets and watches, intelligent glasses that are being used, helping people with visual deficiencies. There are also sensors. In many cases, they are stuck to the body, which sounds strange. It registers and monitors certain variables that are necessary to monitor that pathology. And it gives us personalized information on the patient. And finally, intelligent clothing, which is used in the world of sports because of convenience. Many football players, NFL, have to wear a wearable because they use this very much. This is a sector where artificial intelligence is very developed, and they find it very convenient to wear something on their wrist or even on the T-shirt, facilitating the fact that the player feels comfortable and is monitored at the same time. Now, some things that we have developed to give an idea of the very diverse things we can do. The last application we developed is a tool that once is the Sermes patient trial to connect patients with clinical trials. Not everything has to do with the diagnosis. Many times, some of the people you may know might not have a therapeutic alternative and won't know if they can participate in a clinical trial. OAFI does a huge task, or any patients association can inform about these things. But some people are at home and they don't know where to begin. My advice is that they become members of these associations. We work with patients associations to promote and facilitate access of patients to clinical trials, to promote contact with doctors no matter where, what city, what region. We bring the clinical trial to the patient. We also, one of the latest apps on systematic reviews, very interesting for scientists. Before the clinical trial, you have to look in the literature extensively, the topic of study. We try to develop a tool that helps systematize and automate all this to make it faster and to accelerate the clinical research, to help have new drugs in the market more quickly. Classification of different disease with DICOM files, which are could be like magnetic resonance imaging, a technology that will help us have a huge quality in terms of pixels to analyze lesions. In this case, they help us to classify types of disease depending on the image obtained. A algorithm to pre-diagnose mental health. We've also dared to tread in this world to analyze pre-diagnostically when a person could suffer from a cognitive impairment of some sort. but it should be in a very early phase. And telemedicine. We have tried to have tools to make your life easier, to monitor patients from home or to monitor patients in a clinical trial. The patient many times has to go to the hospital, and thanks to this technology, we could cut down those times. Now, about what you, the topic of our interest. What does artificial intelligence do in pre-diagnosis and diagnosis? I'd like to introduce the latest news. For example, AI is identifying lesions in the knee cartilage. As we heard before, artificial intelligence is exploring how to automatically identify those cartilage lesions, which is most helpful. It helps you realize before it hurts if you are suffering from this lesion or not, based on other parameters or an X-ray you would had from another pathology. Early detection of osteoarthritis and distinguishing between rheumatoid arthritis, psoriatic osteoarthritis, and classifying the differences. They've developed also intelligent soles for healthcare professionals that can prevent, detect, and treat things like osteoarthritis or lumbar pain. They are being tested to ensure that the results are reliable and see if they could be extrapolated in the general population. They've identified a biomarker of images with artificial intelligence for knee osteoarthritis. This is a super finding because it's true that they've been for many years trying to see how to identify knee osteoarthritis through a biomarker that could be shared in all those diagnoses, and this has been a wonderful finding. And in artificial intelligence, it really helps us create tools to automate even more the diagnosis of the disease and the prediction of the results of total knee arthroplasty. Also, research on automated research and the total knee arthroplasty and how the patient will feel, how satisfied the patient will feel, or whether there will be complications. So it's capable of predicting so much. Within artificial intelligence, the treatment and follow-up of pathologies. I'm going fast because I know I suppose you might want to break for lunch. Artificial intelligence can help you accelerate all the work in healthcare centers, which are very saturated, and it also helps us manage, predict, diagnose, and our daily work, taking out the mechanical tasks from healthcare professionals so that they can focus on medicine. Artificial intelligence also accelerates the initiation of treatment. If in the past it took about a year to find out what you had, with artificial intelligence tools, that diagnosis could be faster, and you can start your treatment before. And as Tomás was saying before, artificial intelligence can help follow or identify pain. There are tools that are they're already trying to identify when a person is in pain. Through face sensors, expressions, and different stimuli, it could be detecting when a person could be in pain, when and where. So they're investigating to predict this. And I have to say that we are delighted if you want to have a tool instead of with cows working with people. We'll be delighted to help out in that sense with those sensors, those ankle sensors. Artificial intelligence also helps follow remotely the patients and their disease. Telemedicine, so popular after the pandemic, can also help us obtain all the data in the medical office and combine that information. avoiding information gaps, things that we could forget. It helps us keep that information and show it to the doctor in the following visit, from one visit to another. And it also analyzes combination of treatments. This is a gap that we all suffer from. It's true that if I have my specialist, I have several doctors depending on my pathologies. Maybe between them, because they are in different centers or for whatever reason, they cannot speak with one another. And I have different treatments for different pathologies. Artificial intelligence can help see the interaction of these different treatments in one person and say, look, you have these problems because of the interaction of these two drugs that you're taking, for example. This could also be very helpful in our day-to-day.
Bueno, comentaros el tema de la rehabilitación ya como último.
Also, rehabilitation, as you'll know, there's artificial intelligence in telerehabilitation in the osteoarthritis of the spine. There are specific platforms for this. Through the phone camera, in a customized way, depending on your ailment, you could do the rehabilitation you need. And many of them verify that your exercises, the exercises you're doing in the right way. This is very convenient for us. Many times we don't exercise because we're lazy, and it also helps us so that we can start a healthy lifestyle. And finally, the conclusions. As I said in my presentation, in artificial intelligence are tools that can learn and analyze very quickly huge amounts of information from the patients to help professionals. How can it help professionals? Among other things, it helps do a better diagnosis and treatment, and as you've seen, it could also help in many other ways. We improve the prevention of diseases with artificial intelligence. It helps improve quality of life of patients. It helps with precision medicine to decrease clinical variability. How many of us have gone to ask for a second opinion? And different eyes have seen different approaches of your pathology. This is just a tool. It will always be fair. It improves the efficiency of health management, decreasing the workload of healthcare professionals, and it allows the healthcare professionals spend more time on research, which is what we all want, to relieve our healthcare professionals from all of the paperwork and make them focus on medicine. And let's ensure that they can do what they know how to do best and evolve. And that's it on my behalf. Thank you so much. It's been a pleasure.
Gracias. Muchísimas gracias, Marta.
Thank you, Marta. Thank you so much. Please don't go. No one has fainted yet, right? No sugar level drops. It's been very interesting, and I thought, my goodness, artificial. Let's give some intelligence to some people. We have a question here, Carmen here. Carmen Sanchez has a question. We have this in our hospitals already. Yes, in some hospitals, not all. Especially in private hospitals, yes. These tools are found more easily in private hospitals. They're usually quite expensive because in the end the investigation process has to, but it could be cheap in the long run. Because prevention and prediction, yes, indeed, as Sol Ruiz was saying, these are costs that seem great, but in the long run, if you could look into the future and you analyze the system into the future, you see it really is very cost-saving. Thank you for your intervention. Wonderful. I wanted to ask, is it easy to integrate a unit in the hospitals with artificial intelligence? Because many times patients wonder, this doctor said that, and the other doctor said this. take this on an empty stomach. And 3 doctors said three medications on an empty stomach. So what do I take first? So many things that maybe with artificial intelligence, patients could get some help, because many people complain about this. We are seen by many, but then how do we do it? How do I combine all these things? Right. You are absolutely right, Carmen. I think that the tools we have now in the market that are available already should be integrated in all the hospitals. And we have many problems. I am not an expert. I don't work in the public healthcare system. And I wish we could have someone from hospital management who could give us this information from within these hospitals. But as always, it's very complicated to implement things in the public system. In the end, we have the public system, which is wonderful. It can be improved, certainly. There's room for improvement, and this is one of them. We depend on the community, the city, the region, this and that. So having a healthcare system that is equal for all, integrating these tools is very complicated, as it is to enter in the clinical history outside of your hospital or your city, which is unthinkable. It kills artificial intelligence. So all patients of all specialties always say the same. Why do the tax authorities find us so easily, but not the medical authorities? Yes, indeed, totally agree.
La has clavado, Carmen, la has clavado.
Yeah, you hit the nail, Carmen. Yes, you should think that it's important for patients to be able to drive the therapeutic programs for patients. Do I think so? Yes, absolutely. Yes, I do think. I think, yes, there are empowered patients. That's what we are aiming for. No one should force us and learn about what we're not interested in. But it is true that expert patients have the best criteria to take decisions and to decide on their treatment. Yes, we work with OAFI and with other organizations of patients because it is indispensable that you are in all processes. Doctor. Yes, I want to thank Marta. Manso is an extraordinary engineer. I think we're one of the first in Spain on this. OAFI works very well with them. They help us very much. Most statistical and computer things that we do with them, they do them for free with OAFI. We had a survey on healthcare services that we will present next year on the different regions, and they always help us. And they are great professionals, very helpful. We're trying to prepare a huge database in OAFI and to propose a set of algorithms for artificial intelligence to prevent osteoarthritis. Something that I would like to say is that they are a company that has a huge social side to it because many people have physical problems. And they're great professionals, as I said, so I don't know what to say. I mean, it's such a pleasure. I see no reason why we shouldn't continue cooperating. Yes, we feel the same. I'm serious. one doesn't really take into account people who have physical disabilities, who are deaf, have difficulties walking. We have to be more solidary. We are in a society that is very narcissistic and selfish, and more every day. I think that being solidary with people who have difficulties writing or speaking or seeing is very important, and they work very well. And I have to mention it. I have to praise it. And I wish there were many companies like yours in the country. We have one last question.
¿Ibas a contestar, Marta?
I just wanted to say that thank you. I'm not a doctor, but besides all the wonderful things she said, she's great as a speaker, and she is enthusiastic. I don't know if I should ask a question because the last words were so nice. I was surprised to hear when you spoke of different studies with a possible biomarker in artificial intelligence for osteoarthritis. I would like to ask you if you could tell us, as you know, osteoarthritis has an important gender component, and the biases and the limitations, databases, images that could be used when applying artificial intelligence. Yes, that's why I said we're working on it. What we've identified after many years of work is that biomarker that helps us determine or create an future artificial tool that could be based on that biomarker in the clinical image that we have of many knees. Imagine all the research that has been done with the millions and millions of images to be able to identify just the biomarker. Now, artificial intelligence will get images to teach a tool to automatically see what that human eye saw, to be able to identify who has been diagnosed, who has a greater chance of being diagnosed with this pathology or not, and to be able to tell us this person has a certain percentage of likelihood to suffer from this. Unfortunately, it's a very long path, but we're on it. The idea is to evolve and to continue with these talks and explain that this is what is being done. It's very important to see what others are doing, to shed some light. It's been a pleasure, Marta. Thank you so much.